Good evening and welcome back to Hobbservation Point Live. I am your host, Chuck Hobbs. As we talk about almost each week, all of us are having to deal with the reality of the coronavirus pandemic. We are now 7 months into it, and it looks like there will be no break in sight, according to which epidemiologist that you listen to. With that, many of us are figuring out ways to cope, while at the same time, we have had to deal with the deaths of friends and loved ones from this dreaded disease. Unfortunately, we all also know that this disease has ravaged the Black community in a way that it hasn't other ethnicities. With that, I am bringing in tonight a group of my friends who practice medicine, one public health official who's also a professor, and an insurance executive who will be able to talk to you about some of the things that many of us are talking about at our lunch and dinner tables on a day-to-day basis, which is how do we survive this pandemic, both from a physical standpoint, from a mental health standpoint, and what will happen if the United States Supreme Court ultimately strikes down the Affordable Care Act, also known as Obamacare. So with that, I'd like to welcome my panelists tonight. I have with us my old friend from Tallahassee, Florida, my little brother, Dr. Rodney Allen. Welcome back to the show. My Morehouse brother, Mr. Ben Green, who's an insurance executive, who will provide very salient points tonight about the issues that all of us are afraid about. We have Dr. Sonya Marks, who is an OBGYN, who will be talking about her practice and some of the things that she is seeing with regards to this disease. Also invited my Spelman sister, Ericka Goodwin. Now, Sonya and Ericka are also line sisters of the AKA sorority Alpha Kappa Alpha. I'm sure they'll say it in the long, drawn-out way that they're known to do. And I look forward to speaking to Dr. Goodwin tonight. She not only is a psychiatrist, but she also is a politico. She has a show that she does as well that helps many of us navigate the mental health ravages of this disease. And last, I have one of my oldest friends, my good friend, my FAMU Rattler brother, my brother in Kappa Alpha Psi fraternity, Dr. Michael J.L. Smith, who is a professor at Florida Atlantic University right now and a director of the PIMS program. He also is a public health expert. Good evening, everyone. I'd like to
Good evening.
Yeah, Rodney, I want to start off with you first. When we talked last back in August, you had an answer that really got a lot of attraction from a lot of my viewers and readers with regards to some of the scientific reasons behind why it is that Black people seem to be suffering from COVID-19 in ways that other races are not. I would like for you to take the ball and run with that, so to speak, this evening. Why is it that we are struggling with this disease more than any other race?
Well, it's for all the reasons that everyone talks about. Blacks in general have higher rates of chronic illness and disease, such as hypertension, such as diabetes, such as reactive airway disease or asthma, and of course, obesity. In addition to that, there are a number of barriers to access to care for African Americans. Some of us still don't have insurance. Some of us don't have very close-knit relationships with a primary care provider. And sometimes even with insurance, African Americans are troubled with the dilemma of paying even the copay for medications, paying for copays for diagnostic tests. And so even the middle-aged, slightly obese African-American male who is being treated for diabetes may be walking around with an A1C above the desired amount, even though they're receiving treatment, even though they're taking their medicines sometimes. And so when you compound chronic illness with limited access, with or without insurance, with suboptimal control of these chronic conditions, you're at risk. You're at risk for outcomes that are not as good when you have an illness or a condition or a disease. I think those are the biggest factors, and I think that accounts for some of the disparities that we're seeing.
Got you. Michael, I want to throw this over to you as well. I know that you have written and spoken passionately this year about social distancing and mask wearing. Have you been shocked as a public health professor an advocate that this has become a hyper politicized issue here in America. And it is one reason why it seems as if the numbers continue to spike north, despite what some of our politicians in America have to say.
Right, Chuck. What I've seen, and as I speak to colleagues around the nation who are public health practitioners, physicians, scientists, we are all just flabbergasted by the fact that science has become something to question. Once upon a time, science is what led, this country to develop the technology that it has. Now we have people, for political reasons, are leading a campaign against science, questioning the very thing that allows us to live the lifestyle that we do today. The simple fact of the matter is that if our country, our government, and our country as a whole responded to this pandemic in the way that we have traditionally responded to outbreaks, epidemics, and other pandemics around the world, we would be in a much better place. Something as simple as wearing a mask. In the early days when this thing first hit, there was a great deal of question as to how the disease was transmitted. So at the time we were recommended that people get really good masks, N95 masks. As more information came out about the disease, and we started to learn more, we realized that the disease is transmitted in the droplets, from our airways, and also can be transmitted through our eyes as well if droplets get into our eyes. And so we realized that it wasn't necessary to necessarily have a N95 mask, but simply a covering to catch the droplets as we speak. Because most people don't realize that every time you speak, we all release some droplets from our mouth. And depending upon your health conditions, you may also have some droplets come from your nose. So understanding that, we realized that we just needed something to catch those droplets to significantly reduce the spread. And how it's become politicized that, if you're on the right, you don't wear a mask, and if you're on the left, you do. It's absolutely ridiculous. It completely blows away those of us who are in the field of health and science. We've received really good guidance from the CDC before the federal government started to complicate things. And Dr. Fauci has really been pretty straight on about what we need to do. So hopefully America will start to act right, and we can really get this pandemic down to baseline.
Yes, sir. And I'm going to be coming back to you with some Florida-specific questions also before the night ends. I want to move over to Sister Ericka Goodwin. Dr. Goodwin, I started watching some of your posts earlier this year when you started going live. Looks like you were doing some of the same things from the medical side that I am trying to do with the social, political, and legal issues that we deal with, and sometimes sports here on Hobbservation Point. With that in mind, people are stressed. People are stressed out. In fact, I have been very transparent this year about my own stress and the fact that my walking, the good benefit of it, like Rodney was talking earlier about the A1C levels, my A1C levels are down. I am off of insulin. I've talked about how I am a diabetic and I was taking insulin shots several times a day. Now I'm down to none. But the walking really started just because I was stressed out. I was just about to just explode, and walking every day kind of helps that. Can you talk to us a little bit about, from being a psychiatrist, some of the things that you are seeing or some of the concerns you have with regards to Black mental health?
One of my biggest concerns when it comes to Black mental health is that we haven't had a chance really to talk about it because we literally just started, is that none of this stuff is happening in a vacuum. So one of the things that's complicated is that for a lot of people, their emotional reserve is low between dealing with this pandemic, the increasing dehumanization of Black people, this interesting election, I use interesting in air quotes. There's just so much going on that people's emotional reserve, especially being Black, is low. And then just feeling like anytime you leave the house is a potential threat to your life. and the fact that we have a reality-based fear in the fact that there is an infectious disease out there that the worst case scenario, it could kill you or your loved ones. So what I'm seeing is there are more people approaching me and my colleagues to get mental health treatment that don't have a significant history of mental health treatment in the past, or may have had some small issues, but nothing really that big, nothing big enough that they went ahead and saw something for. So you're seeing this group of people that are becoming overwhelmed, having difficulty functioning, that didn't previously have established mental health issues. Then you're seeing the people that have established mental health issues just dealing with this higher level of stress and lack of feelings of safety. I'm also doing some work at the VA, and it's interesting seeing how this is also triggering a lot of vets. But one of the complicated things is, on one hand, due to the fact that so many things have gone virtual, that a lot of our services from my particular field are actually more accessible now than they were before, because they released a lot of the regulations when it came to telemedicine, and the service that we provide can be provided without touching people. So in some ways, if someone is interested in treatment, we're actually probably a little bit more accessible than we were before. But we're seeing the same things that a lot of other specialties are when it comes to acute care, where people were afraid to go to the hospital or they weren't going to appointments, so that when they show up, especially at the hospital, they're significantly sicker than they would have been otherwise. So the people that are getting admitted are significantly sicker. When they present, they need higher levels of interventions than they would have otherwise. But it's affecting everybody.
Dr. Goodwin, with that, I want to follow up real quickly with regards to telehealth. You mentioned telehealth. Can you explain to our viewers what telehealth actually is? And from a practitioner standpoint, does that give you the same level of satisfaction when working with patients as being able to be across the desk or in a room with a patient?
One of the things I can honestly confess to, Dr. Ericka confessed, that I am enjoying telepsychiatry infinitely more than I ever thought I would. That's my confession. I will not go into an Usher song right now. But one of the unique things about it is that, especially if you really take the time to help people understand what the process is, the difference isn't as profound as you would anticipate. And especially in this climate, we're able to keep everyone safe. If I'm seeing someone through telehealth, well, you're not getting exposed to anyone or even me on your way in, and I'm not exposing you to whoever I have been around. So what telehealth basically is it's seeing someone. Usually it's an electronic modality. Most people, you can use phones, tablets, computers. Telehealth can actually include when people are seeing people via just straight telephone calls with no video. A lot of us have been able to transition to video, and at some point we probably can talk about some of the difficulties in some of our communities, because people may not have access to a smartphone, or they may not have reliable internet, which makes it difficult for them to have some of the interfaces for the video calls, which is why it's important for us all to continue to fight for decent reimbursement for voice calls, because some people, they don't have access to video. But it's typically your doctor or whoever is seeing you is on one end, you are on the other, and we're holding the entire conversation through some type of digital medium. For me and for what I do, I can literally do the whole visit that way. There are some other specialties that they have to do a few things that are a little bit more creative, because for some of my patients, actually, I don't even have on my medicine. So if we don't get vitals every visit, it's not a big deal. But most people can have the basic things at home, such as a blood pressure cuff, because they're automatic cuffs. Depending on what people need, you can get a pulse ox. And there are a lot of things people can do at home to help their doctor who's on the other end manage them.
Very good. Rodney, I saw that you raised your hand. Did you want to follow up on Ericka's point about telehealth?
Absolutely, Chuck Hobbs. Thank you very much. I just would echo everything that Ericka mentioned about telehealth. It is a much needed addition to healthcare. I say addition, but it's really not an addition. Physicians have been providing healthcare information and healthcare evaluation over the telephone all the time. It's just that the big thing with the coronavirus and some of the leeway granted by the CARES Act, it allows physicians to actually receive reimbursement from insurance companies by providing that same telehealth. So it's not that physicians have not wanted this for quite some time. For what I do as a subspecialty surgeon, I really want to check in with my patient and make sure that a couple weeks after surgery, the incision is healing, and I can do that with the photo, and that they have adequate amounts of pain medicines, and that they are actually in physical therapy and not having chest pain or shortness of breath. But absolutely telehealth, and I will clarify, the payment for telehealth during this coronavirus pandemic is huge. And as Ericka pointed out, it represents another form of disparity, because African Americans don't have the high-speed networks that are required sometimes. People in rural areas lack the high-speed networks for adequate telehealth engagement, and some African Americans don't have telephones. I had a consult for a tibial plateau fracture in the emergency room. They didn't show up. I looked at their information, and no telephone number was listed. And it turns out that patient does not have a telephone. So that patient will show back up in the emergency room at some time. This time they will probably need to stay in the hospital, and that's the burden that we as a people have to deal with due to the socioeconomic disparities.
Yes, sir. Sonya Marks, I want to bring you in. I know that you have practiced for a number of years in the specialty of OBGYN. I know that from time to time you make posts about having to deliver the babies and deal with women's health. With that in mind, over the last 7 or 8 months, when we're talking about this coronavirus pandemic, what have you seen in your own practice at the hospital? How has this changed your ability to deliver either preventative health care services like mammograms, colonoscopies, as well as delivering children, especially with regards to some of the restrictions that we are seeing in hospitals now in terms of who can visit and at what times people can visit newborn and their mother?
Definitely, living in the age of coronavirus has changed how we practice in the field of obstetrics and gynecology. I work more in an acute care setting, just purely hospital setting, so I'm not in office setting. But definitely, it has created a unique set of issues that we're facing in regards to delivery, because moms come in, they're not able to, have as much of the support persons accompanying them for their deliveries and visits to the hospital setting, because we do have to, implement restrictions for their safety, for the safety of other patients that are hospitalized, for the safety of the babies and infants that are in the hospital, and of course, all the staff and personnel that are involved in taking care of them. I guess some of the positives, if you want to say, regarding pregnancy and coronavirus, it hasn't been shown as of yet that pregnant patients are at any increased risk of having more serious illness when they have the coronavirus infection. But we still do consider pregnant patients clinically vulnerable to coronavirus, just because we know that pregnancy can alter how the body responds when you do have a serious illness. So, for example, with other viral infections like the flu virus, we know that those infections can be more serious and more complicated in patients who are pregnant. rather than if they had that infection and they weren't pregnant, you can have more serious complications. A lot of our patients are concerned if they have the viral infection, what is their risk of transmitting that infection and the virus to their babies during pregnancy. With the information that we have available currently, it hasn't been shown that it's that common for the virus to be transmitted from mom to baby during pregnancy or delivery. So, that's, a positive for right now. But unfortunately, if you are pregnant and you do develop serious illness from coronavirus, that does put you more at risk of having to be admitted for a prolonged amount of time. You're more likely to necessitate being admitted to the ICU and potentially requiring assistance with mechanical ventilation. We also have our, special increased risk of if you have serious complications from coronavirus while you're pregnant, that you may end up having to be delivered early. So you're more at risk for having a preterm birth. And that you also would be at risk for potentially having a C-section, cesarean delivery. So, both of those circumstances have their own unique set of risks. So if you're talking about delivering a pregnant patient early, depending on, what point, what gestation that patient is, then, that baby is going to incur risk of complications of prematurity potentially. They may require that baby having to be admitted for a prolonged amount of time to the NICU. And, that has its own special risk. And then if you're talking about having to be delivered by cesarean section, then that has its own short-term and long-term risks that, we have to take into consideration also.
Very good. And I'm going to come back to you in a little bit as well. I want to shift to Brother Green. Ben Green, I don't want you to feel as if you've been iced out here. And again, I'm glad to have you here, brother. One of the things is, I think this evening, Judge Amy Coney Barrett will ascend to the title of Justice Amy Coney Barrett. It's all but a given that she will be confirmed to be the next justice on the United States Supreme Court. With that, 2 weeks from now, while we are all excited about the election that's coming up next Tuesday night, and we're going to talk about that as a group here before we end as well. But the week after the election, the United States Supreme Court will hear a case that ultimately could determine whether or not the Affordable Care Act, also known as Obamacare, is struck down. If it is struck down, experts are concerned that millions of Americans who right now are being insured because of the ACA's protection for people with pre-existing illnesses, if that goes away, the concern is what will happen to those of us who fall into that category of being uninsurable if you look at how things were prior to the implementation of the ACA. What are your thoughts about that, brother?
Yeah, so and thank you for having me on. So the honest answer is we don't exactly know what's going to happen if they do strike down the ACA and really kind of take away those provisions for folks with pre-existing conditions. Folks that are if you're currently employed with the company, they have group health insurance. We're pretty sure that those folks that do have pre-existing conditions will still be able to get those group health plans and keep their health coverage and be covered and not have to worry about pre-existing conditions. But for the tens of millions of people that are insured on the individual marketplace now, we're not really sure exactly what's going to happen if it's struck down on November the 11th, I believe that the date is. And so we right now we do have some provisions in place. We do have some plans in place, and we serve folks in South Carolina, North Carolina, and Georgia, and we do have plans in place for folks on the individual marketplace that are healthy and don't have a lot of conditions like diabetes or cancer or have had heart attacks and so forth. But if you do have pre-existing conditions and you for whatever reason you do not qualify for subsidies on through Obamacare through the marketplace, plans, you can have some, you could have problems with some of the solutions that we do have right now. So I do think that if it is struck down, probably be about they would have to give probably a 2 or 3 year period at least of transition for folks that are on the marketplace plans to come off of those plans. Because it took about 2 or 3 years to ramp up, from 2010 to 2013 to offer, Obamacare or, ACA plans on the marketplace. So you're probably looking at that same time frame for a transition. However, what is it going to look like after that? Honestly, we do not have an idea.
But with regards to that, you spoke about how for individuals who are healthy, that there are plans that are still available right now. I want to shift though to the ones who are not. Folks who fall under the category have issues like I do. I've had issues with diabetes, had issues with hypertension. Understanding that if I were to try to get a private plan after the 2 or 3 year transition period that you're talking about, and going by a hypothetical here, hypothetically, if Obamacare is struck down and 2 or 3 years later, what options would there be for me? Or would it just be I would be a burden on the emergency care system? I do know that I've read quite a bit about that in the past, those who are uninsurable basically just go to the emergency room, and what the ER doctors can or can't do, it is what it is. What are your thoughts about that? And Mike, I'm going to come right back to you. I saw your hand.
Well, and as Rodney said, even if even if folks are insured, if their deductibles are too high or if the co-pays are too high, a lot of times they will go without that care until it is, and it is an emergency. So even folks that are insured sometimes are still not getting the care they need. But if you are kind of currently uninsurable, if you will, on the individual marketplace, we have some solutions where we can definitely get you into, see doctors 5, maybe 10 times a year with co-pays, and it will include things like lab services, for example, and things like stops at urgent care, for example. But the issue comes when you need some hospitalization, when you need to go in for a surgery, or if you have, something major happen, you had an accident and you have to be hospitalized for a couple of days, for a week, et cetera. Or if you have critical illnesses, for example. So you may, for example, have diabetes, and that's your pre-existing condition, but down the line, diabetes can cause heart attacks. It can cause, kidney failure. It can cause all those sorts of things. And that's where right now we run into problems, really kind of plugging that hole, if you will, or filling that gap for folks that have pre-existing conditions, if they're not, with a group health plan, and if they, for whatever reason, do not qualify for subsidies through the marketplace. And the reasons you might not qualify for a subsidy through the marketplace is if, for example, your job does offer a group health insurance plan, but it maybe is too expensive. But if it is deemed inexpensive or affordable by the government, even though it may cost you, $150 or $200 per month, and if you cannot, you can't afford that, you try to go on the marketplace, you're actually ineligible for subsidies and therefore ineligible for, for affordable insurance through the marketplace. So those are some of the ways in which folks are ineligible, even if they have these pre-existing conditions. And right now it can be difficult to really, shore up their coverage if they're not, if they're ineligible and they have these pre-existing conditions.
Yes, sir. Mike, go ahead. I know you were waiting patiently.
No, thank you for the opportunity. If we lose the Affordable Care Act, it will be a terrible setback for this country on so many levels. And I think a lot of people who are supporting otherwise don't really understand the reality of it. Most of America, if you are not very wealthy, most of America are really just one medical crisis away from bankruptcy. Okay. No matter how good your job is right now, family member, mom, dad get really sick. We don't know how long they will be hospitalized. You are one medical crisis away from bankruptcy, more than likely. Okay. The Affordable Care Act, although not perfect, and I don't know any health program or any health initiative when it was initially rolled out was perfect. There was a big debate and fight about, there was a big debate and fight about Medicare when it came out, a big issue about Social Security when it first came out. So the Affordable Care Act was not perfect. In Barack Obama himself said that it was not perfect, that it needed a number of improvements, but it has been the best structure, the best framework that we've seen come out of any administration. So, and the thing of it is that there has been absolutely not one thing suggested by the other side to somewhat replace it to make it right. Okay, the Affordable Care Act needs to be built upon. I actually had an opportunity to meet with Congresswoman Lois Frankel last year, along with a group of other healthcare professionals in Palm Beach County. And she asked us a question. She asked those of us, around the table, what is it that Congress needs to do for those people to increase access to healthcare? And, I said, we need to build on Obamacare. There are a number of people around the room who departed. There was one fella on the other side of the table, the big table, if you would, who agreed. But a number of people started to depart because members of political parties have pecked away at the Affordable Care Act to now it is a shell of what it was initially intended for. And understand this. I think this is something that a lot of people have missed also. We right now in this country, we have more than 8 million cases, more than 8 million cases of coronavirus in the United States. All those people are now classified as having a pre-existing condition, okay, including the president. All right. So for us to destroy it, it makes no sense to me, and it makes no sense to most healthcare professionals that I've spoken to around the nation.
Wow, that's an interesting point with regards to the fact that you have 8 million Americans struggling with the disease that are now considered also having had a pre-existing condition. I hadn't thought about it like that. I want to shift to Ericka, then Ben, I'm going to come back to you. Ericka, I saw that you wanted to have a follow-up on this issue with regards to the Affordable Care Act.
Thank you so much. I appreciate it, Chuck. So I just want to back things up a little bit. So since I'm in mental health, one of the things I deal with are naturally people with mental health issues. Now, the first thing to keep in context is the average person that is struggling with mental health actually never sees a psychiatrist. Majority of them are actually housed within the world of primary care. So you add all those people in primary care, all those people that see psychiatry, and then everyone that's on the struggle bus that is in with one of us. And right now there are a lot of people in the struggle bus that aren't necessarily with a mental health care provider or seeing their primary care provider. Now, one of the hallmarks of almost any type of impairment from any kind of mental health issue, from an adjustment disorder, which is kind of typically like having quite a bit of anxiety, some depressed mood or some irritability, but not necessarily being all the way depressed or having an anxiety disorder or a traumatic disorder or something like that. From the low end of you are just stressed out so much you can't function quite as well, to the end of the spectrum of having a major anxiety disorder, depression, bipolar, schizophrenia, something like that. The one thread that goes through it is something called there are cognitive issues. Cognition just means how you think. Think about when you're totally stressed out. Think about like when you heard about how George Floyd died and you just couldn't quite put things together. The thing that happens with all of this mental stress and all these mental health issues is people are not thinking clearly. They're not going to have the highest level of executive functioning or problem solving ability. The last thing you want to have is a health system that's already very difficult to navigate on a good day is lose all the structure, and everyone that is stressed out or dealing with mental health issues or having difficulty that is not able to think at their highest level of capacity, then have the responsibility for trying to have to figure it out. I think that's the one thing that we have to all keep in context here is we're in a situation where nobody is at their best to begin with. Everyone is stressed the heck out. No one is thinking on every single cylinder. And then you're going to handicap the situation by removing resources that people couldn't totally figure out how to access on a good day. So I just want to say, keep in mind that this has huge consequences, especially in the world of mental health, because we've been fighting for parity forever. People couldn't hardly get our services. And then there are these sweet spots when it's insured, when it wasn't. And then it got a little bit better with the Affordable Care Act. But if we lose it, you think you see homeless people on the street right now?
Yeah. Yeah. And Ericka, I'm worried about a lot of that too, in regards to people who are triggered. Everybody is trying to cope at every job, you name it. Sometimes when you're out and about, if you have to be out taking care of business, you can see it in folks' eyes. You know, even with the social justice summer that we just went through in regards to all of the protests, how many times did we see where individuals were protesting and the next thing you know, you've got somebody who's a counter protester who's pulled a weapon on a set of protesters? Or unfortunately, like what happened up with Kyle Ritterhouse in Kenosha, Wisconsin, 2 people died ultimately from that. So again, I think that the issues with mental health care are so crucial right now, because none of us have had to deal with anything like this. This is the first time since the influenza pandemic from well over a century ago. With that, Ben, I saw that you wanted to jump back in. Sonya, I saw that you raised your hand as well. So I'm going to go to Ben, then to Sonya. Go ahead, Ben.
Yes, Chuck. So there a lot of good points made. So to Ericka's point, the individual insurance plans we have for folks, if they have pre-existing conditions, they cannot get mental health coverage, first of all. And even if you're healthy, for some of the short-term plans and individual plans we have that are not covered by the Affordable Care Act right now, they do not offer mental health coverage. And obviously, this is like the worst time ever to have a mental health issue and not be able to get that coverage and get those issues taken care of. But Chuck, to your point, on November the 11th here, we may have about 10 or 15 million people find out that they're going to lose their health coverage. And this is the worst time ever, probably in the last 10 years to have something like that happen. And so it's really unfortunate that we are going to find out about that after the election, so that we cannot have a proper discussion about it before the election. And that was done, obviously, probably very intentionally, to make sure that didn't come into the fray enough. And I really, really thank you for highlighting this important issue. But it's really unfortunate that we're not able to discuss this from October the 11th up to next Tuesday here to really kind of dig in on what the implications are for this law potentially going away, because it will be huge.
Absolutely. Sonya, you wanted to weigh in on this issue?
Yeah. So, I guess as it relates to pregnancy and the Affordable Care Act, one crucial aspect of the Affordable Care Act that affects pregnant patients in particular is the expansion or lack thereof of Medicaid. Upwards of 43% of pregnant patients' payments are covered through Medicaid. So, we have these issues currently that we were already dealing with before the pandemic, regarding, Black women and maternal morbidity and mortality, and how some of those rates have been harmed by the lack of expansion of Medicaid and lack of access. So definitely, if you terminate the Affordable Care Act and you throw out access that patients who do have Medicaid and are able to access their prenatal care through their Medicaid insurance, and then you still are preventing other patients from having that same access, then we're going to see an even further exacerbation of some of the issues that we're already facing in regards to the fact that Black women are 3 to 4 more times likely to have negative outcomes during pregnancy and delivery, and a lot of it goes back to access.
Yes, absolutely. You all, I actually want to segue into a related but separate topic right now, and that is specifically vaccination. We all remember from school, some of us learned it before we arrived at Spelman, Morehouse, and Florida A&M University, but at a minimum, if you didn't know it before, you knew it by the time that you graduated, about the Tuskegee syphilis experiments from the 20th century. With that, those experiments have informed how many of our ancestors, or even our parents, and even our generation, have dealt with the concept of being delivered vaccinations. Many of us are concerned about that. I noticed earlier this summer that the presidents of Dillard University and Xavier University have already signed up their schools for potential testing of any COVID-19 vaccines that might come down the pike. I would like to ask each of you what you think about the potential vaccinations. We know that big pharmaceutical companies are in the process right now of working day and night to figure out who can deliver the first vaccine. President Trump often touts that it's right around the corner. Other public health officials and experts tend to say that it probably will be the spring or the summer before it comes online. But when it does, is this something that Black people should rush and do, or should we sit back at first and wait before we jump into it? Who wants to take that first?
Chuck, I think I'm in a unique position as an epidemiologist and as a professor at a College of Medicine. And the Tuskegee study comes up every time we have a case study that touches on vaccinations. In general and historically, first of all, the United States has one of the best, if not the best, public health infrastructure in the world. That is before this current administration started interfering with operations, procedures with the CDC, Department of can't think of anything right now, but Department of Health and Human Services, as well as FDA. I am a strong proponent of vaccinations. One of the greatest public health successes, or the greatest public health successes, was the eradication of smallpox, through vaccination. One thing about America is that it loves its animals, loves its dogs. And folks get their dogs vaccinated left and right, don't even think about it. You got to get shot, baby. I'm a big proponent of vaccination because I know they work. And they are our best tool against diseases. But with the current state of affairs, with the government interfering with the natural process that FDA typically goes through, giving clinical trials the right amount of time to pan out as they need to and not be rushed. Whenever something is rushed, it is something to be cautious about. But I don't want that to make Black folk think that if a vaccine comes out, that we don't need to take it. I know everyone talks about the Tuskegee study, but there are many other issues in medicine as it relates to Black folk that are reprehensible. It's just that the Tuskegee study sticks out. But I, as an epidemiologist, won't be the first one to sign up for vaccination, I want to wait. I would wait, and I would see how these vaccinations with other groups go. I don't want our community to say no to it because it is protective. If it is good, if it is a good vaccine, if it works, it is protective of us. And we being the most vulnerable groups, because as the doctor said, we have so many pre-existing conditions and so forth, we do need vaccination. But in terms of being one of the first, I'm a bit hesitant on that.
Understood. Rodney, I want to ask you that. What are your thoughts on that? Did the presidents of Dillard and Xavier make a good decision in regards to saying that they would allow the trials to take place on their campuses, or should Black people be a little bit more circumspect on the issue?
Well, thank you, Chuck Hobbs. There are so many different levels and angles to discuss this topic. And I'm just going to throw out two sides. First, each of the physicians on this panel are members of their various respective organizations. And as a member of the organizations, we have a responsibility to the public to kind of toe the line, walk in step with what is acceptable as a physician. So from that perspective, as a physician, I have to advocate to patients to follow the recommendations from the CDC, follow the recommendations from the major organizations that provide insight and knowledge. The thing we have to realize as individual physicians, even though we are educated, even though we have our own opinions, as an individual, we have a very narrow perspective. It is hard to forget about the one patient or the one nurse that you knew that got a Guillain-Barré, a bad reaction to a vaccine. It's hard to get that out of your mind on an individual perspective, but we have to rely on science to see entire populations, which physicians like me, subspecialty surgeons, are used to treating one patient at a time. We're not used to treating populations. So from one perspective, we have to rely on the science and the organization and the epidemiologists who are looking at things from a very broad perspective. So that is somewhat of the politically correct angle. Now, from the individual standpoint, the person who looks at the issue diligently and using my own ability to reason, I do have some concerns. It's not that I don't think the any vaccine that's on the way is unsafe. I don't think I don't have a conspiracy theory to think this is another Tuskegee syphilis experiment. I do think that our healthcare system is so driven by dollars and revenues that there are conflicts of interest. There are conflicts of interest with passing or getting vaccines to get through the various agencies. We need to eliminate that conflict of interest. It's very important. This is yet another reason why in America we really need to shift away from this multiple kind of private insurance market to a single payer, one that is driven by society so that we can truly make the best decisions for our population. When I say our population, I mean the entire United States of America, without bias, without individuals getting something through the FDA or getting a nod from the CDC and having this kind of dirty money under the table. So that is my area of skepticism. Medications and vaccine approvals that get through, not because they work, but because of dark money influences. I don't, to answer your question, the presidents of those universities, I believe, are playing the politically correct answer and accepting some of the recommendations that are driven by data and epidemiologists and people who really analyze and look at things. And at some level, you have to trust our system in order for it to function.
Indeed. And before we move on, I've just learned that Justice Amy Coney Barrett is a reality now. She was confirmed by the United States Senate this evening by a 52 to 48 vote. I found it interesting when I was just reading the information provided to me by my producer, Gerald Tooks, that Susan Collins, a Republican who was in a life and death battle for her seat, actually voted not to confirm. So with that in mind, there now looks as if the Supreme Court will have a 6-3 conservative to progressive / liberal split once this decision is made in the next couple of weeks. Back to the subject at hand, Sonya and Ericka, I want to ask you two, what are your thoughts as we head into the late fall and winter months about flu vaccinations. I know also that there have been some concerns from many of the epidemiologists like Brother Smith that, not only are we going to have to deal with COVID-19 over the next 4 or 5 months, but there could be another huge influenza outbreak this winter. What are your thoughts about flu vaccines? Is that something from your perspectives that people should be doing, or is it something that should remain optional? I know some people who see it from both perspectives, and I would like to know yours. I'd like to go with Sonya first, then Ericka.
So, I mean, definitely as a obstetrician and gynecologist, we strongly advocate for the flu vaccinations, especially in pregnancy. So definitely I agree with that. And, like I said previously, we know that viral infections like the flu can be worse in pregnancy, and using the vaccine can help to kind of mitigate some of those risks in pregnant patients. So definitely I advocate for, flu vaccination. I guess as far as the coronavirus vaccination, I kind of agree with Dr. Allen as far as, we want everything to be done safely as far as the production and clinical testing of the virus. And so as long as those things remain in place as they have been up until now, then I would be fine with having the vaccination for coronavirus as well. But definitely, we advocate for flu vaccination.
Excellent. Ericka, what are your thoughts on the flu vaccine? Is that something that people should do, or is it optional from your perspective?
I would say that this falls in the same thing as everything else. Life didn't stop just because of COVID. Flu didn't stop just because of COVID. Flu didn't decide it's taking a break because we got COVID. So at the end of the day, the flu vaccine is relatively effective. Why take a chance on getting super sick with the flu when you don't have to in an environment where the healthcare system is stretched to its limit dealing with a pandemic? Because the other risk is that the consequences of flu and things that were easy to intervene on may be more complicated due to access if the system continues to get overrun by COVID. The next thing is we're in a situation where we're in a pandemic. You want to do everything that keeps you as healthy as possible so that if somehow you get exposed, you are able to not get COVID. So why take a chance on getting sick when there's a really good solution to help prevent it, or at least have you have a milder case if you were to get it? I'm a huge fan of the flu vaccine at this point. There's just, it's an unnecessary chance to take. And I feel like that's the space we're in right now. Is there are a lot of things that are pretty analog, very simple. Just do the simple things and it will make things much better. Why take chances?
Indeed. You all, we're coming up on the end of the hour almost. So what I want to do as we bring this to a close is I want to give each of you an opportunity to make a closing statement. But before I do that, I want to thank each of you, not just for being on this show, but for what you do. Mike, as an epidemiologist and a professor, I know that you're out there on the front line, not just educating and crunching numbers, but also placing yourself at risk because you are out educating the next generation of epidemiologists as well as medical professionals. Likewise, Ericka and Sonya, I know Ericka was speaking about the telehealth, but still you're placing yourself at risk when you actually are having in-person meetings. Likewise with you, Sonya, anytime you go into the hospital, I know that you're placing yourself at risk also. Rodney, likewise for you. And Brother Green, as an executive with insurance, you also have to deal with your customers also. With that in mind, I'd like for you to close by talking about how you all are coping under this pandemic and how it is impacting not just how you work, but also, your own familial or personal dealings and relationships, how you're coping with the stress of this pandemic. So I want to start, we are gentlemen, so we're going to start with the ladies first. We'll start with Ericka and then Sonya, and then we'll wrap it up with Mike, Ben, and then Rodney Allen, my Leon County brother, who you'll take us out. So go ahead, Sonya first, then Ericka.
So I guess as far as how we cope personally, it can be overwhelming to have to, bear the weight of not only trying to keep your patient safe, but, keep yourself safe. And, I have children and, I have to worry about my exposure risk to them. So, definitely I have my routine every day coming home from the hospital to, I go through my decontamination process to, just try to minimize risk of exposure to my family. Coping, I'm sure Dr. Goodwin can speak to just the emotional and mental strain that, we also go through as healthcare professionals from, what we see and the patients that we take care of. We carry that with us day to day. So any bad outcome or, patient that's sick or affected, we carry that with us long after our, interaction may have stopped with that patient. So, I have to do things to, try to lighten the load once I get home, listening to music, watching mindless TV, and just, trying to get in quality time with, friends and family via phone or FaceTime. And, just try to stay mentally healthy for ourselves and our patients and our families.
Absolutely. Ericka?
So to put this into context, this is a global experience that we are all experiencing individually. So I'd say one of my closing things is release yourself of this expectation to not only be perfect, but that your experience during this time is the same as someone else's, that it can be very different per person. And I really feel like part of the keys for us to get through this, other than some good science, is with grace, love, and hope. That those three things are going to be hugely key for us to make it through, because it's a challenge. It's stretching us emotionally, spiritually, and physically. And if you ask me what's one of the things I think has been huge for me, is I'd say the one thing I'd say other than those, if I had to say something that's specific, is make sure you are intentional about connecting with others. And the key is intentional, because this environment can naturally be isolating, but it doesn't have to be. But you have to be very intentional in your actions, intentional about reaching out, intentional about coming up with creative ways to connect, because we're just not going to be doing the things we were. But if you're intentional, you won't end up isolated, and that isolation can be devastating. Even before COVID, loneliness itself can have significant physical impacts and shorten life. So I just encourage everyone to intentionally connect with people and let people know how you're doing. No one knows to help you if you say you're okay. They're going to think you're okay.
Amen. Mike Smith.
Yes, sir. Thank you for the question. And I'll try to be brief. When Michelle Obama said that she was experiencing what she felt was some low level of depression, that resonated with me very closely, because that's kind of what I was feeling. I reflected on the words of James Baldwin when he was explaining to a radio host once, said it's not necessarily about what's happening directly to you, but it's about what's happening all around you. And with the events of George Floyd, of course, the isolation of the pandemic, you start to feel some kind of closing in of the wall sometimes. I explained to some of my white colleagues that Black folks, when we go into the workplace, we've been wearing masks long before COVID-19 ever came on the horizon, and now we're having to wear another mask, try to shield that kind of stress that we feel as we look at everything that's going on from things in politics and the pandemic and social unrest. But for me, my sustaining grace has always been my faith in God. That has been my sustaining thing. When those clouds get really dark and gray, that's my go-to place. And to be clear, I am an epidemiologist, but I teach at a college of medicine, and I actually teach, medical students, the next generation of physicians. And I have this semester, I have classes Monday through Friday, and they, as Dr. Goodwin mentioned, relationships, my interaction with them on a regular basis, on a daily basis, gives me new energy. As well as I'm very fortunate to be here in Palm Beach County, whereas the beach is right at my back door. And so I take time to go there to vent, to free myself. And I try to find safe spaces away from others, but where I can decompress. And I think that thing, decompression, is really key for our people. So my recommendation is to, make connections with people, utilize these video platforms to connect with family. I just had a meeting with my family the other night, and find your faith and let your faith be your foundation and your guide.
Amen, Noop. Brother Green, what are your final thoughts?
I'm just smiling because these are all great recommendations. So for me personally, actually towards the beginning of the pandemic, I started gaining some weight, and that was certainly the wrong thing wrong way to be going during the pandemic. And so last 3 months or so, I've lost weight, and I would kind of challenge everybody to kind of take a look and see if they can lose a little bit of weight, and kind of, go away from, being, having these chronic conditions, basically, because that's really, as Rodney mentioned a couple of times, is really important. That's why a lot more of us Black folks are dying and getting sick than other folks. So focus on, trying to get healthy. So I've been doing more meditation. I've been, taking more vitamins and making sure my, for vitamin C, vitamin D, zinc, making sure my family is getting some supplements. And as Michael mentioned, I've been taking a little bit, personal day here and there. Done a little, single mancation, a couple of times in the last couple of months where I go off for a night and just chill out and do nothing. And then I've given my wife the same grace and same opportunity to go do the same sort of thing, or kind of take a night off and chill out and socially distance, with the ladies, and just kind of relax, because as everyone's mentioned, we're in a really stressful situation, and that's when you get sick, and that's when even worse things happen. So, making sure you're decompressed, making sure you're staying healthy, and trying to eat healthy, and exercise is really important. And then in terms of a call to action, Obamacare is still the law of the land for right now, and even if it is taken away, it probably will take 2 or 3 years. So November 1st to December 15th is when you can sign up for the Affordable Care Act coverage and get covered. And then we're in Medicare season. I started October 15th, been seeing folks in their front yards, under trees and so forth, on porches, until December 7th to help them get covered. And diabetes drugs at least have come down in price. There's some new caps on those types of drugs starting January 1st. So at the very least, that is exciting. So people will be able to take care of themselves a little bit better. So I would say stay healthy, and get covered, and make sure you're taking advantage of your coverage.
Thank you, Brother Green. And Dr. Allen, last but not least, what are your final thoughts?
I'd like to say to everyone out there, you will get through this. We will get through this. To echo all the other panelists, be intentional about your social connections. Be intentional about spending the time with your family. Look at the glass from a half full perspective. If your kids are at home, that's time when, as adolescents and teenagers, children drift away from their parents. You take advantage of this time. For me personally, our work has been the same or greater during this COVID season. Be grateful for that work that you do. Be grateful for waking up with a sense of purpose every day. And if you are one of the unfortunate individuals who does not have a job right now because of layoffs and COVID, make it a point to be intentional about having a purpose every single day, whether it is to drop 10 pounds or read a book or learn a language. Wake up with a sense of purpose that will help you get through this moment. And remember, take the advice of the scientific community. Wear a mask, social distance. That's the low-hanging fruit. You have to really accept the science. Lastly, as others have pointed out, try to engage in healthy habits. Chuck, I think you've done a great job with the walking and sharing that among all of your friends who follow you. And that is contagious. I think you have led by example. Get rest. Try to stay healthy. Find outlets that don't expose you to the virus. Now is not the time to scratch going to an Ohio State game off your bucket list. Read a book. Spend a little time outdoors away from other individuals. We will make it through this experience together, and we will all be better on the other side.
Amen. Dr. Allen, Mr. Green, Dr. Goodwin, Dr. Smith, and Dr. Marks, thank you. I always brag on my friends. I have so many brilliant friends that are doing so many great things across the country, and I'm appreciative when they think it not robbery to come on Hobbservation Point and spend a few moments sharing their expertise and thoughts with you. And I also want to thank you, those who watch Hobbservation Point each week. It's on Monday nights as well as on Friday nights when I join the Steel Sharpen Steel crew. I look forward to getting up with them this Friday, as I have been mentioning for the last couple of weeks. On election night, the Steel Sharpen Steel crew, Tom Cunningham, Joyce Stevens, and Sharon Letman Hicks, along with yours truly, we will be streaming all night long. We are going to be watching the election results. We are going to be opining, and we're going to have all of the Hobbservation Point Roundtable crew coming in and out over the course of 4, 5, 6, 7, 8, however many hours it takes to get the job done. That's what we are going to do. And we invite you to come and hang out with us some too, to get the up-to-date analysis. Also, if you have not voted, early voting is still going on across the country. Make sure you vote. Make sure you take your mom and your cousin, them too, if they're still here. It is so important this year, more than any other year, that you do vote. There are so many issues that are in play, from the Affordable Care Act to social justice, to education, to healthcare, to criminal justice reform as well. And the only way that you can make your voices be heard is if you go to the ballot box and not just vote in the Biden and Trump election, but also for your down ticket races, your district attorneys, your state attorneys, your mayoral races, the sheriff races. Those are the races that impact you more than even the presidential race ever will. So with that, again, thank you so much for being with us for a few moments tonight. And I look forward to speaking to you again next week on Hobbservation Point Live.